Can men get breast cancer? Believe it or not, though rare, breast cancer affects about 2,800 men a year in the United States and can be serious, even fatal if left untreated. But that's not the only way breast cancer can affect men. It can have a profound effect if they are the caretaker of a loved one with the disease. Good day, everybody. I'm Kendis Gibson, your host for today's discussion, coming to you from the Baptist Health Newsroom. Here to speak about how men can navigate breast cancer and whether a patient or a caretaker, and shatter those stereotypes, are radiation oncologist Dr. Joseph Panoff from Baptist Health Miami Cancer Institute. Great to have you here, Dr. Panoff.
Great to be here.
And also with us, Marlon Hill, you see him there, whose wife is a breast cancer survivor. 16 years. Happy to have you here as well.
Great to be here.
Appreciate this discussion. It's an important discussion, as always. And I do want to remind the viewers before we get started to send in your questions and comments in the comment section throughout the discussion. We're here for you and happy to answer any questions that you might have. So when we hear the words breast cancer, though, we do, of course, tend to think women. But men do get it as well. 2,800 men, as we mentioned, do get it. It is still a scary diagnosis, doctor, for those men when they get it.
Absolutely. I think one of the issues is that most men don't know that they can get it and don't know that it's even a possibility. And so that is a challenge when diagnosing it.
Yeah, what's the percentage you would say?
It varies by geography, which is very interesting, actually. In the United States, it's about 0.5% to 1% of all breast cancer cases are found in men, whereas in other places, including, say, Africa, it's much higher, actually around 6%, which is thought to be related to higher levels of endogenous estrogen because of possible certain liver diseases that are found there that are endemic. So it can vary by geography, but yeah.
Huh. All right. Well, and we'll get back to the geography of it because that's quite fascinating to it. But Marlon, your wife is a breast cancer survivor, as we mentioned, and you have been very much involved in her journey. Tell us about the struggles and the success stories, I guess.
I really don't consider it a struggle. It's really a triumph, right? Mm-hmm. We're celebrating our 25th anniversary of being married, which means we've been together for a very, very long time. Mm-hmm. But she was a kidney transplant patient, actually, when we first got married after a year after we got married. So later on, years later, I would say about almost 10 years later, when we were going to a wedding, and she was trying on a very slinky, beautiful spaghetti strap dress, and she felt a lump, and we said, well, you know what, I felt it as well, and said, we need to get that checked out. Got a biopsy, and turned out to be stage 2, and she did a partial mastectomy at the time because the impact of the kidney transplant, we didn't want too much trauma on her body, and then the cancer came back 2 years after that, after chemotherapy and all that, and then mastectomy did the job. So 16 years later, she's triumphantly here and thriving.
And still a part of the movement, doing marches and part of many volunteer efforts as well, right?
Well, it's all an education effort, right? Black women are 1 in 4 black women are impacted by breast cancer more, and you heard the percentages in regards to men. So for us, early detection is key. Those of us who have West African genealogy, definitely more aggressive forms of cancer, because she was only in her 30s when she first had the disease. So that was interesting for us to kind of learn those kind of statistics. And I think that choosing to have the surgery was a very good decision, even though it's unique to most women, but it was good for her.
Yeah, so, and the numbers, at least from what I read here in the States, it's 1 in 8 women, which is striking, get breast cancer compared to 1 in 853 on average here in the U.S. for men. That said, what would be the symptoms for men, doctor, to look out for?
The main symptom is going to be the feeling or palpation of a lump or mass in the breast. I'd say half of the cases present with a mass or lump behind the nipple. Men's breasts are generally smaller, So that's why there's so many that present right behind the nipple. And it's usually painless, and that is the main presenting symptom for men.
Yeah, and what are the treatments? Are they similar to the of a woman?
Right. They're very similar to women. I'd say the main difference is that men are more likely to have a mastectomy than breast conservation, again, because of the small breast size. And there's not as many cosmetic issues with men with regard to breast conservation. But everything else is the same. So if they need chemotherapy, they're going to have that. If radiation is indicated, they would have that, just like a woman.
So, but with women, you know, it's recommended the body check and other. With men, because it's such a small number,
right? So it's different, right? So men don't. Like I said, there's not a lot of understanding in the community about it, or in the camaraderie of men.
Yeah, we
don't really know, and so there's a couple things I would say. One is for men who have a family history, they're at higher likelihood, especially significant family histories. And then men who have a BRCA mutation, specifically a BRCA2 mutation, are at higher risk for breast cancer.
Yeah, Marlon, what kind of advice would you have for any man that gets that diagnosis?
You know, you got to know your body, right? And you got to, don't waste any time getting things checked out, for sure. For us, as a couple, what we learned in our journey with breast cancer is that the support system is very important, right? And not just a support system, a positive support system. All negative people, stay away. For sure.
Which should be
a rule in life.
Exactly.
But more so when you're going through a health crisis, it's important to have that type of positive energy and support that you need. And also most importantly, to get informed. Go to those doctors' meetings and understand, what the margins are, what the different numbers, because each woman and each man, each of us are unique human beings, right? So every cancer is unique to each person. So understanding the impact of that cancer on you personally is important for you to kind of know exactly how you're going to meet the treatment that's going to be diagnosed by doctors, by Dr. Panoff.
So doctor, there's the treatment, and then there's the medical treatment, and then there's the mental treatment for a man.
Yeah.
How do you address that once you tell somebody that this is your diagnosis?
Yeah, so I like to think of it as a whole person approach, like Marlon was talking about. And I think that you can tie this into the male support of the woman and the man who gets the breast cancer. Yeah. And there's a physical component and there's a mental component of support. The physical component, like you are saying, is going to the visits, right? Going with your spouse to the visits. So listening, taking notes down, right? Because she has so much going on. How's she going to remember everything? Right. She needs you, right? I mean, it's huge, and you can you can do so much with that. Asking questions if you need to, being there for everything, and even extreme cases, holding a cold cap, right? And then the mental component is supporting as a loving spouse and being there in all ways, and it's those two things.
Is it preventable in men?
There's no data that shows that there's anything a man could do to prevent it. Yeah. I guess if you were to not have a certain if you could prevent a liver condition that increased circulating estrogen levels, that would be, but that's very challenging.
Yeah. And a lot of
it may not be preventable, but it's detectable.
It's detectable.
Right? So the sooner that you can find that out, whether it's breast cancer or any other cancer, what I learned is that you have to be very proactive in your self-care.
Yeah, absolutely. So for men who might have a mass, don't sit on that. That might need to be checked out. If you have a firm mass that's painless and it's growing or it's not going away, that there's a possibility that could be something more than something benign. So that might need to be seen by a doctor and even biopsied.
Wow. And so the treatments are varied as well, and how you get it or why you get it could depend on diet, DNA, geography.
Yeah, DNA a lot. DNA a lot. Geography, exactly. With men, it usually presents a little bit later, the more locally advanced, because men don't expect it as much.
Yeah, all right. Well, let's get to and go ahead to take some of the questions from the viewers. One of them mentioned, should men be examined regularly for the condition?
I don't think that's not required in the literature or part of any guidelines.
Yeah.
It would be only if a man palpated something or if his doctor palpated something that they would then work it up.
Why isn't this more mainstream for men? I mean, do you think about that at all on any given day?
Through my experience with Carla, yeah.
Yeah.
I think about it now. I mean, through a kidney transplant and 2 breast cancers, everything is front of mind to me now. But for someone who's newly married, not thinking about a health crisis, many young people these days are not thinking about these things. My advice is that life changes in a snap of a finger. You got to be ready, right? And the more information that you have at your fingertips, you just get more confident. You walk into a hospital or a doctor's office, you can ask the right questions, and it definitely helps with your treatment and even your mental state. Just being more informed makes you more confident.
And I bet it makes you more appreciative of every day that we have and every minute that we have. Do you also recommend therapy for men and women, mental health therapy for men and women who are going through?
I think it's case by case. If, for someone who needs that, and there's many people that do need it, who are getting treated for breast cancer. It's a long road, especially if you have more locally advanced disease. And absolutely, if you need that, and
I definitely think that taking time out and treating yourself to things that are not associated with going to chemotherapy or going to radiation, and doing the things that you love and are passionate about, it's important. Life in general, right? But I do think that that's important. Whether you're a caregiver or you're a person that's in the crisis, I think it's important to share with your family members exactly what you're going through, because that support system, again, is critically important as a part of the extension of the treatment that you would receive from caregivers at Baptist Health.
And that's actually one of the questions from, are there support groups for men with breast cancer?
There are. There's online support groups. There's a support group through Susan Komen, and there's all sorts of resources and support groups, even for men. Right. Absolutely.
So the takeaway I get is it's not preventable, but it's not the end of the world.
Correct. If you catch it early, and even if it's not that early, it's very treatable, it's curable, and just be vigilant. Men should be vigilant and just aware of the disease, that it exists. I would say it's rare for men, but it exists.
Yeah. Well,
and for the caregivers, listen very carefully to your spouse. Try to understand that it's her unique journey. You are just part of that support system. It's not your cancer, but you are part of the extended care for her. Make sure that you are in touch with her healthcare providers as well, because they may have questions to ask you, and even as she doesn't want, obviously there are privacy issues as well, but in the case that they need your support, being aware of the types of medicines and things that she's going to. Those things are helpful.
The thing I would add to that is there's body modification for women when they get breast cancer. And so as a spouse, I feel it's extremely important to support that, right? That a woman is beautiful, and even with changes, that this is the same person, and that person is beautiful.
Carla goes by the name of Breastless Beauty.
What is it?
Breastless Beauty. Without the vowels, without the E, without the A, Breastless Beauty. And she's taking that on using fashion. She's a fashionista, so she uses fashion as an inspiration to give her the strength to express herself.
So kind of reclaiming her past.
Absolutely.
And
reclaiming her power.
Exactly.
Reclaiming her time.
Owning it.
Right.
Exactly.
Absolutely.
I really appreciate this discussion, gentlemen. Really appreciate it.
Thank you so much.
And to you, remember, be sure to hit that subscribe button on our channel here to keep up with the very latest health and wellness information and tips from our experts. You can also connect, of course, on social media, Facebook, Instagram, Twitter, TikTok, LinkedIn, and check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, stay healthy, stay safe, and thanks for watching.